to the District Attorneys General Conference. Under Biden, national data showed that illegal aliens were pouring in from countries all over the world. And the Tennessee Migrant Crime Report also reflects this. There were 92 unique countries of origin from Mexico and Guatemala, Jamaica, Romania. Here's the bottom line. Because of Joe Biden's open border policy that was supported by far too many of my Democratic colleagues, thousands of crimes were committed by thousands of criminal illegal aliens in the state of Tennessee over just a 3-month span. And this, my colleagues, is just one state. This is my state. But we know this is happening in communities all across this country. More than anything, the report underscores the importance of President Trump's mass deportations, which are underway. There are many ways that Congress can support these efforts. My CLEAR Act, which I've talked about many times on the floor, would ensure state and local law enforcement officials have the tools to help the federal government deport criminal illegal aliens. This is crucial, especially when you've got far left leaders like the Chicago mayor refusing to turn over criminal illegal aliens to federal custody. Now, General Bondi is suing these sanctuary cities for allowing criminal illegal aliens who have no right to be in our great nation to harm Americans. And thank goodness she is being tough on crime. I've also introduced the Preventing Violence Against Women by Illegal Aliens Act, which would allow the deportation of illegal aliens convicted of sexual offenses or domestic violence. Any illegal alien who commits these heinous crimes should be removed from the country immediately. And I encourage all of my colleagues on each side of the aisle, support this. And my Container Act would ensure that border states like Texas have the legal authority to place temporary barriers on federal land to help stop the flow of traffickers, drugs, and criminals coming across the border. There are thousands of criminal illegal aliens residing in Tennessee and across the country. We should be using every resource at our disposal to remove them from our country. In many ways, the bills that I've mentioned would help President Trump to get the job done. I yield the floor.
Mr. President.
Senator from Hawaii.
It is not often that the stakes of a vote to confirm a cabinet nominee are this high. But tomorrow, when we vote on the nomination of RFK Jr. to be the Secretary of the Department of Health and Human Services, the stakes will be life and death. Mr. Kennedy, in his words, but more importantly in his actions, has proven over and over again that he is a unique danger to society. But he's on the edge of becoming the country's top health leader with the power to unleash bygone diseases and undermine trust in science for generations to come. For the first time ever, we will have a health secretary who has actively helped to cause outbreaks instead of to contain them. We'll have someone in charge of medical research who's taken every opportunity to undermine science instead of promoting it. We'll have someone who's never come across a crazy idea that he didn't like, whether it's that antidepressants are the cause of mass shootings or chemicals in the water are turning children gay. This is the Secretary of the Health and Human Services Department. Those two things right there should be immediately disqualifying. This should be 100-0. This guy used to be a Democrat. This guy was pro-choice. This guy was for clean energy. This shouldn't be a partisan issue except to say, for HHS, you need somebody who has devoted their life and hopefully has some expertise in the area of public health. And it's not just that we didn't get someone who has expertise in public health. We have someone who has caused disease and death. And I say those words with precision. I understand that both sides of the aisle are prone to exaggerating their case and being apocalyptic when we describe a pending vote. I've been here for a while, and everything is always the most important vote that we will ever cast. And I don't know if this is the most important vote we'll ever cast. I do think, gosh, I hope I'm wrong. I really do hope I'm wrong. But I do think this is likely the cabinet secretary vote that is likely to age the most poorly, because this person has the potential to actually cause diseases like rubella, like mumps, like measles, like polio, that have been gone for many generations because we have a vaccine regime. And I want to tell you what he did in Samoa. In 2019, he flew to Samoa to discourage people from taking the measles vaccine. And the reason was that he wanted to run a, quote, natural experiment to see how people would fare against the disease without protections. Now, some of you may know this. My father was the first whistleblower against the Tuskegee experiments, in which the United States Public Health Service did a similar thing. They knew that penicillin cured syphilis, and they knew that for the most part, untreated syphilis caused death. But the U.S. Public Health Service decided to divide a cohort of African American men into two parts. One would receive the medicine and be safe and be cured, and another cohort would receive a placebo and not get the life-saving cure for syphilis. And why did they do that? To, quote, observe the disease process. To observe the disease process. So when you investigate whether or not a medicine works, there's a whole process to it, right? The FDA, double-blind studies, all the rest of it. But the basic idea is you're trying to get to some level of reliability and statistical significance so that you can project out into the population what's going to work and what's not. Now, the sick in the head way to do this is to say you can't achieve statistical significance until you just let a bunch of people get sick and figure out what happens. The United States Congress, led by someone with whom I served for a couple of years, Tom Harkin, when they found out about the Tuskegee experiments, made a law against the U.S. Public Health Service ever doing that again because it's immoral. It's bad science, sure. But more than that, it treated these African American men as if they were worth experimenting on, as if this category of human beings in the United States were expendable for scientific research purposes. And that's exactly what happened in Samoa. That is exactly what happened in Samoa. 6,000 people got the measles. 83 people died. 79 of them were kids. It is so chilling to contemplate the idea that someone as recognizable as a Kennedy would fly across an ocean to a small developing country and basically tell everybody, be afraid of this life-saving medicine. And it's not like he did that once and said, I'm sorry, I misunderstood, or I'm being misunderstood. This dude actually sells onesies on his website saying, I think it's like unvaxxed and unafraid for a little baby. This guy has views that are out of the mainstream of, I would guess, 99 out of 100 United States senators. And I do understand the pressure that some of my colleagues are facing. They're being told if you vote against one Trump nominee, you will be primaried. So that's not a small amount of pressure. But this one, I just promise you, it's not going to age well. Some of my colleagues are expressing reservations in private. And I think that's better than not expressing any reservations at all. And some of them are getting private assurances from Mr. Kennedy that he does not, in fact, hate all vaccines. He just wants to answer questions and all the rest of it. I am not reassured. I think this person has demonstrated over a pretty long career that he says whatever is convenient in the moment, right? This is like an unreconstructed, he's Kennedy. He was running for president in the Democratic primary, and now he's a Trump guy like 10 months later. What does that mean? It means he's got no core values, right? Like there's just no way to go from over here to over here politically in such a short period of time, except that he was offered something and he was offered this job. And why does he want this job? Because he's got a very specific view about public health. And I just want to make one other point. The problem of our food system, right? The problem of the extent to which we subsidize ultra-processed foods that are coming from commodities that are subsidized in the Farm Bill and causing people to get increasingly diabetic and all the related health problems that happen related to that. Like that's a really legitimate place to do some good bipartisan work. And I would love to do that. It's also not what the HHS secretary does. It's what the United States Department of Agriculture does for the most part. And it's what the Congress does. The problem is the Farm Bill. The problem is you get what you subsidize. And we are subsidizing all the corn products and all the soy products and all the sugar products that go into the lab tested, extra delicious, extra bad for you, extra addictive stuff that is making us all, even though we're the wealthiest country in human history, a very unhealthy country. And so if that's all this guy we're working on, you can count me in. But if your idea of public health has to do with healthy food, has to do with prevention, has to do with understanding that our food system and our agricultural system and our USDA and our Farm Bill process is essentially broken, you don't actually have to purchase this kind of crazy, evil stuff. You just don't. You don't have to do it. There's lots of good people on the food system side you can work with, work for, cheer on, organize with. But this man is going around, he's not talking about the COVID vaccine. He's not talking about whether or not it's appropriate to require masks in public, where Democrats and Republicans are like still arguing about stuff like that. He's talking about stuff that, like, if you're a parent and now you don't know whether when your kid goes to school, they've reached herd immunity for stuff that is like way, way, way generations back in the rearview mirror. And so I don't know if this is going to mark one of the most important public health moments in American history, but I can't think of another time where we actually have the technology, we have the medicine, we have the science, we have the distribution system, we have the public infrastructure to keep people safe. And we just decide by a vote of 53 to 47 to make people unsafe. So Secretary of Defense, DNI, all these are important. Treasury, every cabinet position is important. It's going to be a little more challenging to know whether your vote is vindicated in the sweep of history. I think this guy is going to age very poorly in the job because I think we are going to see bad public health outcomes very, very shortly. This really is a matter of life and death. And I understand. What I have learned over the last 10 days is if Republicans are going to display courage, it's not going to be on the cabinet. There are a few that have voted, not with their party, but for the most part, like, they're in line and Trump is going to get his cabinet. But let this be a marker for everybody. Let today be a marker for everybody. Even if you voted for Trump, if you didn't vote for Trump, if you're not a voter, it doesn't matter. If you think it's a good idea to leave all of these diseases in the rearview mirror, then this is a very, very bad person to have running the Department of Health and Human Services. I yield the floor.
Thank you, Mr. President. 2 weeks ago, I had the opportunity. 2 weeks ago, I had the opportunity to question Robert F. Kennedy Jr., the president's nominee to serve as the Health and Human Services, to serve as the Secretary of Health and Human Service. I asked Mr. Kennedy Jr. a simple question. What different vaccine schedule would you say I should have received? I asked this question because just 3 years ago, Kennedy said, and I quote, "We should not be giving Black people the same vaccine schedule that's given to whites because their immune system is better than ours." When I asked him this question, Mr. Kennedy referenced a study by Poland, a study he assured me, and not just me, but also my colleagues on both sides of the aisle and the American people watching, that this study asserted that indeed certain races required a different vaccine schedule. That was a lie. In fact, the study's own authors stated the data doesn't support a change in vaccine schedule based on race. Mr. Kennedy's response was damning, and his response was dangerous. And so I followed up following the hearing with a letter and with questions I wrote to Mr. Kennedy. During your testimony, you cited a series of Poland studies that underlie your claims that Black people and white people should have different vaccine schedules. You ended by saying, in that hearing, you don't believe the science, the peer-reviewed studies? Well, Mr. Kennedy, I do believe in science, and I did some digging into the studies you referenced. NPR interviewed the authors of the studies you cited, medical experts with years of experience, and they universally disagreed with your assertions. In fact, Dr. Richard Kennedy of the Mayo Clinic, who was involved in a study you mentioned, made clear that the data doesn't support a change in vaccine schedule based on race. Dr. Kennedy also stated that your suggestion would be, quote, twisting the data far beyond what the studies actually demonstrate. Dr. Gregory Poland, who you mentioned by name during the hearing as doing research supportive of your claim, told NPR that his team, quote, found no evidence of increased vaccine side effects, and that any claim of increased vulnerability among African Americans who received the rubella vaccine is, quote, simply not supported by either this study or the science. NPR quoted Dr. Carlos Del Rio of Emory University as saying that your conclusion was, quote, taking it to a very unsafe place because Black children already have lower vaccination rates than their peers. That is why I said your claims on this issue were dangerous. I have to ask you, Mr. Kennedy, do you still believe that Black and white individuals should have different vaccination schedules? Now, you should think that the man who wants to serve as the Secretary of Health and Human Services, the man who wants to be tasked with the mission of HHS, which is improving the health, safety, and well-being of America, would provide a thoughtful and nuanced response. It was anything but. Because let's be clear, Mr. Kennedy is not a doctor, he is not a scientist. In fact, his only tangential connection to the world of health and science is decades-long activism, questioning the efficacy and safety of vaccines. Maybe I shouldn't have been surprised at his curt and dismissive response. Mr. Kennedy wrote, "If confirmed, I will do nothing as HHS Secretary that makes it difficult or discourages people from taking the vaccines, but instead seek transparency in these products. Yet another lie. Mr. Kennedy's life story is one riddled with quackery and laden with conspiracy theories. I quote him when he said, "There's no vaccine that is safe and effective." I quote, "None of the childhood vaccines have ever been studied." He also said, I quote, "They get the shot, that night they have a fever of 103, they go to sleep, and 3 months later their brain is gone. This is a Holocaust, what this country is doing." I quote, "Autism comes from vaccines. The polio vaccine given to his generation caused cancer that," I quote, "that killed many, 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 many more people than polio ever did. The COVID vaccine was," and he said, quote, "the deadliest ever made." He also said, I quote, "COVID-19 is targeted to attack Caucasians and Black people. The people who are most immune are Ashkenazi Jews and Chinese." He also said, "There's no vaccine that is, safe and effective." All statements made by a man who is asking to be held responsible for a singular mission. The mission of the United States Department of Health and Human Services is to enhance the health and well-being of all Americans by providing for effective health and human services and by fostering sound, sustained advances in the sciences underlying medicine, public health, and social services. It is a task of epic responsibility, a serious job that, when done well, can save hundreds of thousands of lives. A job that, when done poorly, will most certainly cost American lives. And let us not speak of Mr. Kennedy in a vacuum. We have now held the floor multiple times over the past week over a string of nominees that are dangerous to the American people. Not because, and I cannot stress this enough, we disagree with their politics or their worldview. We can have robust policy debate. We can have robust scientific debate. In fact, robust debate has the potential to move us forward as a country. Respectful debate is the hallmark of this body. It is a crucial component of free speech. I went to law school, and I spent years in the courtroom trying cases, making my arguments before a jury of my peers, grounding my arguments for a basic set of evidentiary facts. But what we are dealing with here isn't a debate. It's a popularity contest and a test of loyalty. Mr. Kennedy is not in this position today as the nominee for Secretary of Health and Human Services because of his vast experience in medicine. Mr. Kennedy is not in this position today because of his deep scientific knowledge. Mr. Kennedy is not in this position today because he has respect for the scientific method. Mr. Kennedy is not in this position today because he respects medicine. Mr. Kennedy, like many of his fellow nominees, is in this position today because of his deep loyalty to the President of the United States. What makes our job increasingly difficult as members of the U.S. Senate is that we have the duty to advise and consent. And it isn't just a privilege of this chamber, it's a responsibility to speak for the people of our state as well as the American people as we evaluate the qualifications, the experience, and the temperament of a president's cabinet nominees. What is happening on the part of my Republican colleagues is not advice and consent. The sole qualification being assessed is loyalty. Not loyalty to country, not loyalty to the American people, not loyalty to the duties and responsibilities we have been entrusted with by the voters in each of our states. The sole qualification up for assessment is loyalty to the president. And Mr. Kennedy has that in spades. But loyalty to this president comes at a cost. Not a cost to the billionaires, not a cost to the people in this body, a cost to the American people. Democratic Americans, Republican Americans, independent Americans, Americans who voted for this president, Americans who did not, and Americans who did not vote at all. The president has been consistent that he believes the American people delivered him a mandate to carry out his agenda. With respect to the health, safety, and well-being of America, the purview of Health and Human Services, the president believes that cutting funds for medical research into things like cures for cancer is apparently a part of that mandate. Just this weekend, the president announced massive cuts to NIH, an agency which I'm proud to say has its home in Maryland. The mission of the National Institutes of Health is to seek fundamental knowledge about the nature and behavior of living systems and the application of that knowledge to enhance health, lengthen life, and reduce illness and disability. It falls under the very agency Mr. Kennedy is seeking to run. Here are what some scientists, people I implore Mr. Kennedy to listen to despite his apparent distaste for the profession, had to say about these massive cuts. Dr. Richard Huganier, professor and chairman of the Department of Neuroscience at Johns Hopkins University School of Medicine in my state of Maryland, said, and I quote, "We were all just dumbstruck. I'm calling it the apocalypse of American science. This will basically change science as we know it in the United States. The bottom line is that we are going to have a lot less resources, which obviously means we are going to have to lay people off and research will be slowed down." Dr. Otis Brawley, professor of oncology and epidemiology at the Johns Hopkins School of Medicine and the Bloomberg School of Public Policy said, and I quote, "We're going to see health research kneecapped." Dr. Brawley has actually overseen grants at the National Cancer Institute, which is a part of the NIH, as well as received them from his cancer research. He went on to say, and I quote, "People who are getting treated in clinical trials now for cancer will find many of those trials will close down." Dr. David J. Skorton, president of the Association of American Medical Colleges, said, and I quote, "These are real consequences. Longer waits for cures and for diagnosis, slower scientific progress, losing out to competitors around the world, and fewer jobs. Those who are facing any health challenges will suffer from less biomedical research." Dr. Robert Lefkowitz, a Duke University professor, my alma mater, go Blue Devils, professor of medicine who won the Nobel Peace Prize in Chemistry in 2012, said, and I quote, "I think the American people need to understand how devastating it would be if this goes through. A lot of research would just have to stop. I cannot imagine that the shortfall could be met from other sources." NIH funding supports over 600 current and ongoing clinical trials at Johns Hopkins in Maryland. The NIH supports hundreds more critical research projects and clinical trials at the University of Maryland. Clinical trials in cancer, pediatrics and children's health, heart and vascular studies, and the aging brain. Research on traumatic brain injury to members of the military, suicide prevention, addiction, and patient safety. Clinical trials supporting over 23,000 jobs and $5.7 billion in economic activity in Maryland. These massive cuts will lead to over $200 million in losses to Hopkins and over $50 million in losses to the University of Maryland. Now, I may not be a Republican voter, but I can assure you Republicans across our country aren't seeking to stymie progress on a cure for cancer. By putting the NIH in its crosshairs, the president is targeting some of the most vulnerable Americans. The young child suffering from sickle cell disease, the working mom who's also struggling to care for a parent with Alzheimer's, the family member suffering from an opioid addiction, the father dying of lung cancer, all diseases being actively researched by the NIH. Disease and suffering does not respect the boundary of partisan politics. It impacts each and every American family. And it falls in part to the Secretary of Health and Human Services to do everything in his power to get us closer to cures. Instead, I fear we have a nominee before us who is more interested in getting us closer to conspiracies. And with loyalty to the man in the White House, as opposed to the health and well-being of the American public, Mr. Kennedy is likely to follow his boss in supporting a tax on Medicaid. This administration and my Republican colleagues are seeking to upend federal Medicaid financing and are considering per capita caps and repealing Medicaid expansion funding. Let me make this simple. The Republican framework to cut Medicaid puts nearly 435,000 Marylanders at risk of losing coverage. It will lead to major gaps in healthcare coverage and undermine family economic security. It will put quality care out of reach for more families. And at the risk of sounding like a broken record, these are Democratic families. These are Republican families. That shouldn't matter to the president or the nominee for the Department of Health and Human Services. All that should matter is that these are proud American families. The administration's attacks on Medicaid would kick millions of people off their health coverage and force states to make deep cuts to benefits, eligibility, and reimbursement rates. My state can't afford these cuts. Maryland's families can't afford these cuts. 96% of eligible children in Maryland are supported by Medicaid and/or CHIP. Cuts would disproportionately hurt children with the lowest incomes and the highest health care needs. At a time when Americans are struggling under the weight of inflation, scraping to pay for food, gas, and housing, we cannot strip away or cut their health coverage. That's a cruel move that will certainly bankrupt many individuals and families. Many Americans are one catastrophe away from financial ruin. And if you take away their coverage and access to affordable care, it will be realized. Don't just take it from me. Marylanders have been calling and writing in, demanding that Congress do everything it can to fight against attacks to Medicaid. Jacqueline from Baltimore shared this with us. One day I was at work and passed out in the bathroom. Had to be cut out of the restroom by the firemen. After being in a coma for 12 days, it was determined that I was diabetic. Having Medicaid saved my life. If I did not have Medicaid or any insurance, I would have been sent home and who knows what would have happened. Another constituent from Ellicott City shared this. My 22-year-old son has autism and a significant cognitive disability. He is a happy, affectionate person who loves being around people and being physically active. Due to behavioral challenges at home, he lives in a group home. This environment is one in which he can be safe and thrive. He also attends a program licensed by the state's Developmental Disability Administration Monday through Fridays, 9 to 3. This program provides meaningful day services. Both his group home and day program services are funded through DDA's Medicaid waiver. Given the cost of my son's services and the services of many other individuals with developmental disabilities, a limit on federal Medicaid dollars would no doubt force Maryland to reduce services. If my son was not able to continue living in his group home, he would have become homeless. Another impact of Medicaid cuts could be his health care, as he is fully reliant upon Medicaid for his health insurance. He will never be able to work enough hours to draw health insurance benefits due to his disability. Such an anecdote should stir all of us to action. It should stir the members of this body to take more seriously our duty to advise and consent, to push back against the nominee who sees his role as a loyal foot soldier to one American who sits in the White House and not the millions of Americans whose health and health care are on the line. Last week, I looked Mr. Kennedy in the eye and said I would not be supporting his nomination. I said that his views are so dangerous to our state and to our country that his voice would be a voice that parents would listen to. I honored my constitutional duty of advice and consent. On behalf of every single Marylander who's lost a loved one to disease, every single Marylander who works at NIH or is actively researching cures, every single Marylander who has been led astray by a snake oil salesman peddling quackery instead of science, I will be voting no on Mr. Kennedy for them. And to my colleagues on the other side of the aisle, I urge you to think long and hard about the phrase that you believe encapsulates your mandate, America first. If we are not putting the people of this country first, then we are most certainly not putting this country first. America first cannot exist if the people in this country are too sick to be strong. And when you have someone like Mr. Kennedy responsible for the health of our citizenry, I fear that it is where we are headed, dead last, literally and figuratively. I may not be able to stop this nominee from being confirmed, but I want every Marylander to know that I will never stop fighting for your health and for the health of your loved ones. Thank you, Mr. President. I yield the floor.
Mr. President.
Senator from New Hampshire.
Mr. President, I come to the floor to join my colleagues with a great deal of concern to discuss the Trump administration's nomination of Robert F. Kennedy Jr. to be the next Secretary of the Department of Health and Human Services. To put it very simply at the outset, Robert F. Kennedy, RFK Jr., is unfit to lead the highest health office in our nation. First of all, RFK has no, let me repeat, no health or medical experience. That in and of itself should be a red flag on this nominee who is supposed to be tasked with leading our nation's health agency. But sadly, that's not where the red flags end. From his radical and dangerous opinions on vaccines and other public health, to his promises to cut medical research, to his ever-changing position on women's rights to access reproductive health care, he has proven that he lacks the credibility, the knowledge, and the capability to be the Secretary of Health and Human Services. So let's take a step back. When President Trump ran his campaign, he ran a campaign on lowering costs for working Americans. Well, where has that promise gone? We saw today that inflation has gone up in the last quarter. It's over 3% now. And we've seen nothing from President Trump's first weeks in office that addresses the high costs of healthcare, of food, of housing, of childcare. 2 weeks ago, this administration, including the Health and Human Services Agency, halted funding across the board for programs like our community health centers and substance use treatment programs. These centers are often the main source of health care for their communities. They serve the people across the states of this country. In our office, I heard from programs like Coos County Family Health, a community health center that provides life-saving care to rural patients across the northern part of New Hampshire, what we call the North Country. Their programs for training new doctors and providing services for victims of domestic violence were and still are at risk, thanks to Trump's executive orders and funding freeze. And I heard from Navigating Recovery in Laconia. That's a substance use treatment service that depends on federal funding for more than 50% of its budget. They're worried about keeping their doors open. And this is an organization with providers who will literally sit with a patient by their hospital bed following an overdose to make sure they're getting the best guidance, the best treatment, and the follow-on services like housing and childcare that allows them to start their recovery. And this is a real issue for us in New Hampshire, where we've been hit very hard by the opioid epidemic. The Trump executive orders and funding cuts will force navigating recovery to lay off staff and to curtail services should those funding cuts continue. These are actions on the part of the White House that don't lower costs for families. They do just the opposite. They put people out of work and they weaken our ability to care for our most vulnerable populations. But when he was asked if he would reverse this policy of cutting funding for programs like substance use recovery, RFK refused. The thing is, we should be taking steps right now to lower costs for families and children. Half of the uninsured Granite Staters cite cost as their reason for not being able to purchase health insurance. More than 2/3 of people in New Hampshire have delayed care, and another 25% have delayed buying needed prescriptions or said they have to ration their meds. We could help these people right now. We could pass the Healthcare Affordability Act, which would make permanent premium tax credits in the Affordable Care Act that have cut healthcare costs for 24 million Americans, nearly 70,000 from New Hampshire. Passing that bill would directly help constituents like the man in Newmarket who contacted our office. He's 55 years old. He's a patient at Lamprey Health Care, which is a community health center. He had been uninsured and avoided going to a doctor his whole life. But sadly, he was recently hospitalized for 10 days because of complications from untreated diabetes. He had sepsis and he had an infection in his foot. Unfortunately, he didn't have insurance when he was hospitalized. But luckily, Lamprey Healthcare sat with him, helped him purchase insurance on healthcare.gov, helped him avoid potentially devastating medical debt. These tax credits are vital to his and to millions of Americans' ability to afford health care. But again, when asked about these tax credits, RFK refused to say that he would support extending them. So much for any concern about lowering costs for families. Now, if this administration is not trying to lower costs, what are they doing to help the people they swore an oath to serve? Last Friday, our research institutions got a notification almost overnight that their funding through the National Institutes of Health, would be gutted. This decision threatens our ability to find cures for diseases, to get ahead of public health crises, and to hire and retain talent. I think it was made rashly and irresponsibly without really understanding what the impact would be. Slashing those funds won't make research more efficient. Instead, it's going to cripple our ability to treat and cure horrific diseases. Dartmouth College, which is in Hanover, New Hampshire, is one of our preeminent research institutions in the country. Last year, Dartmouth received nearly $100 million in NIH funding to help with its cutting-edge research to treat diseases like diabetes, cystic fibrosis, and Alzheimer's. This NIH decision, this decision by the Trump administration, will cut Dartmouth's funding by $38 million. And we don't know what the future impact of that would be. Will we miss the next cure for a pediatric cancer? Will we fail to advance treatments in Alzheimer's? What we do know is that this has an immediate impact on the people living in the Upper Valley of New Hampshire. More than 1,300 employees are supported by federal grants at Dartmouth, and the vast majority of these are supported by the National Institutes of Health. The job loss, the economic impact that will result from this decision will be devastating. And sadly, once these jobs are gone and the researchers leave, there's no going back because they're going someplace else. They're going overseas. But we unfortunately know that RFK supports this decision because he has publicly supported gutting NIH staff and research. And if Robert Kennedy is confirmed, I fear he will do nothing to push back or to reverse these reckless decisions. The Secretary of HHS also holds immense power over ensuring that women in our country have the ability to access reproductive health services, including abortion. Interestingly, I thought this was something that RFK and I agreed on, but now I'm not clear what he supports. He used to proudly say that he was pro-choice, but since being nominated, that belief seems to have disappeared overnight. The only thing I think he truly believes is in his desire to do whatever Trump wants, even if it means compromising his own values. Women in this country need to know that the Secretary of Health and Human Services will defend our rights to access all the health care we need. But at every turn, Republicans and the Trump administration have pushed forward dangerous policies intended to threaten access to full reproductive care. They put on the Supreme Court the justices who overturned Roe v. Wade. And at the state level, they have instituted draconian abortion bans that threaten the lives of mothers. Women are literally dying from a lack of care because of these bans on our health. This is 2025. How did we get here? I remember before Roe v. Wade. I remember when hundreds of thousands of women died from back alley abortions. And are we back to that point? Everyone knows that banning abortion and making women seek dangerous options does not stop abortions. It makes them more deadly. But with RFK at the helm, that's the grim reality we face. He's not someone I trust to defend a woman's right to access reproductive health care. He is not someone I want leading Health and Human Services. Now, one of the few issues that we have some actual insight into are his views on public health. His dangerous, radical, and wrong beliefs about vaccines are well documented. Every child that gets sick or dies from a disease that could be prevented by a vaccine is a tragedy. RFK will not only undermine public confidence in vaccines, he indicated that he intends to continue to profit from anti-vaccine lawsuits. It's shameful and it's corrupt. Now, we've also heard reports that the Trump administration plans to cut as much as 50% of Health and Human Services staff and decimate the work of the Centers for Disease Control and Prevention. The CDC is our first line of defense for public health. Most important, tracking and responding to outbreaks of diseases, not only domestically, but abroad as well. The Trump administration has already taken steps to gut our global health and aid efforts, from withdrawing from the World Health Organization to cutting the CDC and U.S. Agency for International Development. They argue that these efforts are wasteful and unnecessary. But just last Friday, we were notified in New Hampshire that we had only the third confirmed case ever in the U.S. of Clade 1 monkeypox, or Mpox. The case is travel-related, meaning the patient caught the disease abroad and brought it home. Sadly, these diseases don't just stop at countries' borders. They don't just happen overseas. They affect us here at home. The Trump administration's efforts to eliminate our public health infrastructure doesn't make America safer. It doesn't make America stronger, and it doesn't make America more prosperous. It does the exact opposite. And Robert F. Kennedy Jr. is complicit. He's complicit in these efforts, and he will only continue them should he be confirmed. America deserves a leader at HHS who values science, who protects public health, who defends women's rights to reproductive care, to the full range of reproductive care, and who upholds the integrity of our country's core health systems. RFK Jr. has shown time and again that he is not that leader. His dangerous rhetoric on vaccines, his reckless plans to gut critical agencies, and lack of understanding of basic health care make him uniquely unqualified to advance the well-being of all Americans. I urge my colleagues to reject his nomination for Secretary of Health and Human Services. I yield back. Thank you, Mr. President. President,
The senator from New Hampshire.
I yield 30 minutes of post-cloture debate time to the Democratic leader.
The senator has that right. The senator from Michigan.
Mr. President, I rise today in opposition to Robert F. Kennedy Jr.'s nomination to serve as Secretary of the Department of Health and Human Services, also known as HHS. Throughout his entire nomination process, it has become clear that Mr. Kennedy is wholly unprepared to lead this department, which is charged with promoting as well as protecting the health of all Americans. If confirmed as Secretary, he would be tasked with managing programs that millions of Americans depend on each and every day, including Medicaid and Medicare, the Centers for Disease Control, or CDC, the Food and Drug Administration, or FDA, the National Institutes of Health, or NIH, as well as a number of other initiatives aimed at preparing for and responding to public health and medical emergencies. In total, HHS has nearly $2 trillion budget and manages more than 90,000 employees. HHS is an extremely complex organization that requires a leader with expertise on how these critically important programs are actually administered. Yet, during his hearings before the Senate Finance and Help Committees, Mr. Kennedy showed his severe lack of knowledge and understanding about the most basic of federal health programs. Mr. Kennedy could not answer the most basic questions about how the Medicaid program works or how it benefits more than 70 million Americans who depend on health insurance. At a time when Republicans are proposing drastic cuts to the Medicaid program to pay for their tax cuts to billionaires, we need a secretary who will not only knows how the program works, but will protect the access to healthcare services it provides for children and some of the most vulnerable people in our country. It's very clear Robert Kennedy Jr. is not that secretary. During his nomination process, Mr. Kennedy also made it clear he does not understand the differences between the various components of Medicare, a program that keeps our seniors cared for well into their golden years and often plays a key role in a person's decision about whether or not they can retire with dignity. Amid ongoing threats from Republicans to privatize Medicare, we need a secretary who will protect this program that generations of seniors have counted on to get care and generations to come that are paying into that fund for their future. Mr. Kennedy's lack of experience and basic understanding of our nation's healthcare system is, to say the least, extremely alarming. We cannot confirm a nominee who doesn't even know the most basic answers about programs that he's actually in charge of administering. Since Mr. Kennedy was nominated to lead HHS, I've heard from thousands of my constituents from every corner of Michigan, from densely populated cities to some of the most rural areas in our state, who are deeply concerned about his plans for the department would impact families. For example, I've heard from countless folks about the rising cost of healthcare that is squeezing Michigan families' budgets. Healthcare prices are rising faster than inflation, making it even harder for people to get the care that they need. I've heard from a constituent who has operated a food pantry in her community for 13 years. She worries about what will happen to the people that she serves if they do not have access to the food security programs made possible by HHS. In her letter, she shared that most of her people in her pantry services are literally one ER visit or one car breakdown away from being able to feed themselves or their families. Public health initiatives are a lifeline for so many in Michigan as well as across our country. When our neighbors have access to basic health resources, it allows them to focus on improving their lives, whether that's gaining meaningful employment or getting an education. So we need an HHS secretary who is focused on improving access to Medicaid and expanding the premium tax credits for the Affordable Care Act that allows millions of Americans to access affordable health care. That clearly is not Robert Kennedy. He would not be that secretary. Instead, he believes that Americans would rather be privatized for-profit care. HHS is also in charge of providing mental health services and support to communities all across our country. Unfortunately, we have a mental health crisis impacting Americans today, with record high levels of mental illness and suicides, especially among our youth. I received a letter from a social worker in Michigan who helps students who were traumatized by the horrific shootings at Oxford High School in Michigan and at Michigan State University. She is worried that without proper mental health resources, Americans who have been impacted by senseless gun violence, whether at school, at their places of worship, at nightclubs, or at shopping malls, they will grieve and struggle alone. Unfortunately, Mr. Kennedy has only further stigmatized these important resources, even making comments during his confirmation hearing linking an increase in school shootings to an increased use of antidepressants. Mr. Kennedy's ideas would only worsen the mental health crisis that we're seeing today. Instead, we need a secretary who will invest in SAMHSA, the Substance Abuse and Mental Health Services Administration. We need a secretary who will ensure that everyone has access to the programs and health professionals needed to address this mental health crisis. Robert Kennedy Jr. is not that secretary. HHS oversees our nation's major medical research, helping to advance breakthroughs in science and development of new treatments for deadly diseases from childhood cancers to Alzheimer's. Research institutions across my home state of Michigan are conducting critically important research to improve health outcomes for Americans who suffer from these diseases. A Michigan scientist who specializes in CDC research contacted my office. They fear that if Mr. Kennedy is confirmed, it could impact their ability and the ability of thousands of researchers all across our country to conduct medical research that is literally saving lives. In a matter of weeks, we have already seen the Trump administration freeze funding and halt critical work at the National Institute of Health and its research partners across the country. We need a secretary who will fight to do this important research moving forward. Research to cure cancer, to treat deadly viruses, and to address cardiovascular disease. Mr. Kennedy is not that secretary. Advancing medical research is especially important today as we face increased cases of vaccine-preventable infectious diseases like measles. And despite this, Mr. Kennedy has time and time again sown doubt and promoted dangerous lies about the safety of vaccines. And my constituents are alarmed at what that will mean for their families. A concerned mother wrote me in my office that when she was 38 weeks pregnant, and told me that Mr. Kennedy's long history of spreading dangerous medical disinformation and undermining public health initiatives is directly at odds with how she plans to keep her future child from infectious disease. I also heard from a constituent who was born before the polio vaccine was approved. She said that to this day, she can still remember the relief on her mother's face when the polio vaccine became available. This moment has stuck with her throughout her 30-year career as a registered nurse, where she has made it her life's work to study and safely administer vaccines in her community. And let's be clear, let's be absolutely clear. Vaccines are scientifically proven to protect against diseases like chickenpox, polio, influenza, and yes, COVID-19. We have eradicated deadly diseases and protected our children due to incredible scientific advances in vaccine research. But now, vaccine skeptics like Mr. Kennedy have risen to prominence, discouraging people from getting safe, proven vaccines and putting every American's health at risk when it comes to infectious diseases. We need a secretary who understands the effectiveness of vaccines and will do more to prevent these diseases through routine childhood immunizations. Mr. Kennedy is not that secretary. And if confirmed, Mr. Kennedy has made it perfectly clear that he will stand in direct opposition to this evidence-based medicine. Mr. Kennedy's falsehood about basic public health practices have impacts that stretch far beyond our physical health. Another constituent, a clinical therapist, said she is seeing firsthand the devastating impacts that misinformation can have on mental health, adherence to treatment, and overall patient well-being. Specifically, she mentioned that the spread of falsehoods about vaccines, psychiatric care, and medical service fuels distrust in life-saving interventions, exacerbates existing mental health crises, and hinders efforts to connect patients with effective evidence-based treatments. I've even heard from parents who are concerned about Mr. Kennedy's narrative suggesting vaccines cause autism. Because he has given credibility to these lies and questioned facts from scientists and doctors, these parents worry that their children will not receive the most basic routine care that they deserve. And in the midst of so many healthcare challenges, from prescription drugs to mental health to various public health threats, we cannot afford to have someone as unprepared as Robert F. Kennedy Jr. in charge of all these public health agencies. Even well-respected organizations know that Mr. Kennedy would be an absolute disaster for our public health. Take the American Public Health Association, for example. And in a letter, they said, quote, "To effectively lead our nation's top health agency, a candidate should ideally be trained in health administration, clinical care, or a related field, and must believe in and follow the scientific evidence that serves as the basics of our nation's system to protect and to promote the public health from all the threats that we face," end of quote. We simply cannot afford to have someone as unqualified as Robert Kennedy Jr. to be in charge of our top public health agency. He has failed to exhibit even the most basic knowledge of how HHS programs are administered to the millions of Americans who depend on them each and every day. He has misrepresented scientific evidence that is at the foundation of what HHS sets out to accomplish, which is keeping Americans healthy and protected from disease. He has demonized doctors, scientists, researchers, and medical professionals who, unlike him, have actually done the important work to keep our communities safe. I urge my colleagues to judge Mr. Kennedy on his lack of qualifications. It is clear he simply does not have the expertise, the training, or even the leadership skills necessary to lead a department as important as HHS. We need a secretary who will protect the health of Americans. Robert Kennedy is not that secretary. And if he is confirmed to lead the Department of Health and Human Services, the American people will ultimately pay the price with their health. I urge my colleagues to join me in voting no.
Mr. President.
The senator from New Mexico.
Mr. President, just over 5 years ago, Robert F. Kennedy Jr. traveled to the Pacific island of Samoa. Mr. Kennedy was on a mission to spread baseless and debunked conspiracy theories about the safety and efficacy of children's vaccines. Trading in his esteemed family name and peddling himself as some sort of expert, Mr. Kennedy discouraged parents in Samoa from vaccinating their children. The impact of Mr. Kennedy's visit was undeniable. Health providers in Samoa reported that anti-vaccine voices got louder after his visit, and the rate of measles vaccinations for eligible 1-year-olds in Samoa fell to under 33%, well below herd immunity. 5 months after Mr. Kennedy's visit, Samoa had a massive measles outbreak, with 5,000 of its citizens contracting the disease and 83 Samoans dying, the vast majority of which were children under the age of 5. During his recent Senate confirmation hearings, Mr. Kennedy doubled down on his denialism, claiming that, quote, "We don't know what was killing those children in Samoa." Mr. Kennedy also claimed in written responses to Senate questions that my words had nothing to do with vaccine uptake in Samoa or with the 2019 epidemic. But the current top health official in Samoa has denounced Mr. Kennedy's characterization of the measles outbreak in his country and Mr. Kennedy's role in it as an outright lie and a total fabrication. As someone with a background in science, but more importantly, just as a father of two young men, I am horrified by this story. The measles vaccine has been one of the most successful public health and science stories of the last century. One vaccine, administered in 2 doses, now provides protection against 4 devastating diseases: measles, mumps, rubella, chickenpox. In the late 1950s and early 60s, nearly twice as many young people died from measles as from polio. And thanks to incredible scientific research and medical advances, we now have a vaccine that is proven to be safe and effective at protecting our kids from these deadly diseases. This vaccine has largely eradicated the measles outbreaks that used to result in the devastating loss of babies and young children. That is, until anti-vaccine crusaders like Mr. Kennedy started promoting phony science and conspiracy theories in places like Samoa. Over the last 2 decades, thanks in large part to Mr. Kennedy, this anti-science movement has moved from the darkest corners of the internet into the mainstream. And the Samoan story provides us a heartbreaking example of just what is at stake if we give this movement's leader a national platform to spread his junk science. I hope all of my colleagues take seriously what it would mean to confirm this anti-vaccine, anti-science snake oil salesman as our next Secretary of Health and Human Services. As the leader of the largest anti-vaccine organization in the country, the so-called Children's Defense Fund, and I use air quotes for a reason, Mr. Kennedy has repeatedly pushed junk science studies to spread fear and skepticism of vaccines. And it's not limited to the measles. Mr. Kennedy has repeatedly and falsely alleged that safe and effective vaccines for tetanus, for the flu, for COVID, for HPV are dangerous to human health. Mr. Kennedy has even promoted the completely discredited conspiracy theory that vaccines lead to autism. And I want to be real clear that decades of extensive peer-reviewed scientific studies have found no connection, zero connection between vaccines and autism. When he was pressed about this during his confirmation hearings, Mr. Kennedy continued to promote junk science studies rather than walk back his misinformation. In response to Mr. Kennedy's words in his confirmation hearing, Christopher Banks, the president and CEO of the Autism Society of America, said, "The autism community deserves leadership that prioritizes evidence-based policies and respects the lived experiences of autistic individuals and their families. The continued promotion of debunked vaccine theories only serves as a distraction from the critical research needed to better understand autism and provide support for the autism community today." I completely agree with Mr. Banks. Financial disclosures from his confirmation process have also revealed that Mr. Kennedy has made millions of dollars in referral fees from law firms suing vaccine manufacturers based on baseless conspiracy theories. If confirmed, his own personal financial interests could still be tied to these anti-vaccine lawsuits. At the height of the COVID-19 pandemic that led to more than 1 million deaths in the United States alone, Mr. Kennedy campaigned to end the nationwide vaccination effort that helped us save millions more lives. He continued his well-worn and again, completely evidence-free message that no vaccine is safe and effective. And just like with all vaccines, the COVID vaccines went through independent review and extensive trials to ensure that they were safe and effective. If Mr. Kennedy had had his way, we might still be losing thousands and thousands of our family members and neighbors to that virus. Mr. Kennedy has, again, without any sound evidence, also pushed conspiracy theories claiming that antidepressant medications cause mass shootings and chemicals in our water make children gay. And if those claims sound nuts, it's because they are. Mr. Kennedy has said that he is opposed to promoting prescription medications to treat chronic diseases, including anti-obesity medications like Ozempic that are currently used by millions of Americans. Mr. Kennedy has said that he would eliminate the entire nutrition department at the Food and Drug Administration, jeopardizing the safety of our nation's food supplies. Mr. Kennedy has said that he supports gutting the National Institutes of Health, which supports the development of medicines to treat diseases and delivers untold resources to healthcare institutions in New Mexico and every other state in this country. During his confirmation process, Mr. Kennedy also repeatedly made commitments to my Republican colleagues to support restrictions on mifepristone, a medication abortion and miscarriage management drug. Mifepristone has been approved by the FDA for 25 years. It's true that Mr. Kennedy has made a number of conflicting statements in the past about his personal views on women's reproductive health care. But during his confirmation process, Mr. Kennedy has signaled to Republican senators that he will go along with whatever President Trump wants to further roll back women's reproductive rights. Mr. Kennedy is not who any of us should want to put in charge of our nation's health and food safety. The Department of Health and Human Services oversees health coverage programs that serve half of all Americans. HHS plays a critical role in overseeing Medicare, overseeing Medicaid, and the Affordable Care Act. HHS also supports the medical research that helps us to develop the next vaccines, prevent the next pandemic, and find cures to cancer and chronic diseases like diabetes. We have already seen President Trump, Elon Musk, and his Doge minions target scientific and medical research at agencies like the National Institutes of Health. Just last week, we saw them announce an estimated $4 billion cut for health research at universities across the nation, including an estimated $17 million impact at the University of New Mexico alone. And just like many of the unilateral and illegal actions of this emboldened Trump administration, this one received a temporary halt from a federal judge 2 days ago. But whether this particular attack holds up in court or not, the Trump administration's intention is clear. Dramatic cuts to medical research into treatments and cures that countless Americans are depending on to save their lives. Mr. Kennedy plans to lead this effort and even to expand on it. Mr. Kennedy is not who my constituents in New Mexico want to see leading our nation's health agency. In fact, New Mexicans have raised their concerns in letters and emails and phone calls day in and day out. I'm going to take a few minutes to read to you from some of these New Mexicans who are terrified about the danger that Mr. Kennedy would pose as our nation's healthcare agency leader. Melissa from Albuquerque is concerned that Mr. Kennedy's past of promoting misinformation about vaccines and his lack of experience will endanger Americans. Melissa said, "This role demands a leader who relies on evidence-based decision-making, upholds public trust, prioritizes the health and safety of all Americans. RFK Jr.'s history of promoting conspiracy theories makes him fundamentally unfit for this critical position. If RFK Jr. were confirmed to head HHS, millions of Americans' lives would be put at risk. His policies would jeopardize public health and undermine efforts to protect our communities from preventable diseases and health crises. William from Albuquerque, a retired University of New Mexico health communications professor and longtime NIH principal investigator, knows that Mr. Kennedy's harmful rhetoric and lies will hurt public health efforts and lead to unnecessary deaths. William said, "My research team and I have had to continually battle anti-vax misinformation. Robert F. Kennedy Jr. is often at the center of that misinformation. I urge you in the strongest possible terms to oppose his nomination as Secretary of HHS. The damage he would do will take decades to undo and will lead undoubtedly to U.S. morbidity and mortality increasing due to infectious diseases." Jane from Albuquerque is concerned that Mr. Kennedy's lack of experience will negatively impact the health of New Mexicans. She said, "The administration has nominated manifestly unqualified individuals and those openly hostile to evidence to head the Department of Health and Human Services and the individual agencies that are charged with protecting the health of everyone in the United States. This abdication of responsibility will undoubtedly impact vulnerable populations most profoundly, including those living in New Mexico." Mark from Albuquerque, a survivor of polio, knows that the polio vaccine effectively eradicated this relentless and deadly disease. And he is worried that Mr. Kennedy's confirmation could stifle future vaccinations like the one that saved his life. Mark said, "I am a polio survivor. I know that I was very fortunate in my recovery, and I also know that the vaccines effectively eradicated this relentless and deadly disease. So I ask that you do whatever you can to prevent RFK Jr. from overseeing the health care of all Americans." Lori from Las Cruces is also worried that Mr. Kennedy's history of spreading misinformation could harm Americans. Lori said, "If the Senate confirms RFK Jr. to lead the Department of Health and Human Services, Americans' health care will be put at risk and will be ill prepared for another public health catastrophe. We need to push for a qualified, trustworthy nominee to lead America's health policy." Megan from Albuquerque, a primary care physician, is worried that Mr. Kennedy's lack of experience, disregard for evidence-based medicines pose a danger to Americans. Megan said, "As a primary care physician in New Mexico, I am also very worried about the possibility of RFK Jr. being confirmed as HHS Secretary. His past actions have shown that he has little regard for research, evidence-based medicine, or the expertise of scientists and physicians. He is dangerous to the American people." I agree with these New Mexicans that Mr. Kennedy is unprepared. He is unqualified, and he is dangerously unfit to be confirmed as our next health secretary. Unfit to protect our kids' health from debunked conspiracy theories, unfit to defend women's reproductive rights, unfit to safeguard the future of Medicare and Medicaid, and unfit to continue life-saving medical research and medical care in my state and across the country. And for all of these reasons, I would urge all of my colleagues to join me in voting no on confirming Robert F. Kennedy Jr.
President,
The senator from Arizona.
Mr. President, I really care about science. I spent my career as an engineer, as a Navy pilot and a test pilot, and as an astronaut. 3 jobs where facts matter, where you make decisions based on science, not superstition. Because when you're launching off of an aircraft carrier or orbiting the Earth at 17,500 miles an hour, there's no room for conspiracy theories. You have to deal in reality. In my career, relying on science literally meant the difference between life and death. And the same is true for the person who is responsible for our nation's health. The Secretary of Health and Human Services is responsible for making sure that the best science guides our healthcare, from developing life-saving medicines to preventing deadly diseases. This job requires a commitment to science, facts, and to public health. But the nominee before us today, Robert F. Kennedy Jr., has spent much of his career doing the exact opposite, rejecting science, spreading conspiracy theories, and putting public health at risk. That's not someone that I want in charge of keeping Arizonans healthy. And that would be his job, by the way, responding to disease outbreaks, approving new medicines and treatments, overseeing health care coverage for millions of Arizonans and millions more of Americans. So this isn't just some bureaucratic decision that we're about to make. This is about whether the next HHS secretary will protect public health or undermine it with dangerous misinformation. Let's be clear about Mr. Kennedy's record. This is not someone who is simply asking questions about vaccines. Healthy skepticism is one thing, and I always told my space shuttle crew members to tell me when they thought I was wrong, to constantly question the way that we were doing things. We should be doing the same thing here in the Senate. But what Mr. Kennedy has engaged in goes far beyond that, far beyond. Even when presented with definitive science, he's doubled down on conspiracy theories. Because for him, that is what paid the bills. He was the chairman of the most well-funded anti-vaccine organization in the country. The group he led has spread false claims that vaccines cause autism, that vaccines cause cancer, and they cause autoimmune disease. This organization, they filed lawsuits to block children from getting vaccinated. And what happens when people believe that? We get outbreaks of disease that we thought was long gone in the rearview mirror. In America Samoa, he spread misinformation about vaccines during a measles outbreak that killed 83 people. Instead of helping families get life-saving care, Mr. Kennedy sowed fear and doubt. And then he had the audacity to question whether measles was really the cause of those 83 deaths. In Texas, right now today, there is a measles outbreak. It's in a county that has low vaccination rates. So far, all of the cases are in unvaccinated people. Now, we know exactly what causes these outbreaks. It's not science. It's misinformation. It's people like Mr. Kennedy telling parents that they can't trust their doctors. Mr. President, I'm thinking about this nomination, not as a senator, but as a father and a grandparent. I know how much Arizona families care about their kids' health. All they want to do is do what is right for their family and for their kids. And I know what it means to trust doctors, to trust medicine, to trust science. I want my granddaughter Sage to grow up in a world that is safer and healthier than the one before her, where we don't have to worry about diseases that we already know how to prevent. And I think about my daughter, her mom, who, like any first-time parent, is doing everything she possibly can to make the best decisions for her child. And that's already hard enough. The last thing parents need is one more loud voice, especially one in a position of authority, pushing conspiracy theories that make it harder to know what is true. It's bad for kids across Arizona and across the country. And when he spreads these conspiracy theories about vaccines and autism, it has cascading effects. Senator Hassan made this point, I think, better than anybody else could, just last week or the week before. After speaking about her son, who has cerebral palsy, Senator Hassan said, it's a quote, "The problem with this witness's response on the autism case, or the autism cause, and the relationship to vaccines is because he's relitigating and churning settled science, so we can't go forward and find out what the cause of autism is and treat these kids and help these families." She continued, she went on and said, "Sometimes science is wrong, but we do make progress and we build upon the work and we become more successful. But when you continue to sow doubt about settled science, it makes it impossible for us to move forward, and it freezes us in place." So you see, the job of HHS secretary isn't about chasing conspiracy theories. It's about making sure families get the best care possible based on the best science available, so we can make progress and live healthy lives. And folks, here is what makes this even worse, like a lot worse. Mr. Kennedy, get this, Mr. Kennedy vaccinated his own kids while telling other parents not to. His own cousin, Ambassador Caroline Kennedy, called him a predator for what he has done. That's not leadership, folks. That's hypocrisy. And here is what Ambassador Kennedy wrote. "Bobby preys on the desperation of parents of sick children, vaccinating his own children while building a following by hypocritically discouraging other parents from vaccinating theirs." She went on, "Even before he fills this job, his constant denigration of our healthcare system and the conspiratorial half-truths he has told about vaccines, including in connection with Samoa's deadly 2019 measles outbreak, have cost lives." She continued, "And now we know that Bobby's crusade against vaccination has benefited him in other ways too. His ethics report makes clear that he will keep his financial stake in a lawsuit against the HPV vaccine. In other words," this is Ambassador Kennedy's words, "in other words, he is willing to enrich himself by denying access to a vaccine that can prevent almost all forms of cervical cancer and which has been safely administered to millions of boys and girls." That was a quote from his own cousin. The Senate, Mr. President, the Senate cannot ignore this massive conflict of interest. Mr. Kennedy has personally made millions of dollars from lawsuits attacking vaccines, including the HPV vaccine, which prevents cervical cancer. And if confirmed, he would oversee the FDA, the very agency that regulates the vaccines that he is suing over. That's a direct financial incentive to undermine vaccines, even if it puts people's lives at risk. And he wouldn't commit to removing himself from this equation. And it's not just vaccines. Mr. Kennedy has made a career of embracing conspiracy theories over facts. He claims, it's almost would be funny in another context, but Mr. Kennedy, get this, he claims Wi-Fi and 5G cause cancer. He thinks the COVID vaccine is part of a government plot. He suggested that vaccines are a holocaust. But of course, when he was confronted about that, he said he didn't recall saying it. He believes that the people who are running our vaccine programs should be in jail. And when asked about 9/11, one of the most defining moments in our nation's history, he refused to say who was responsible. And his response? He said, it's hard to tell what's a conspiracy theory and what isn't. Well, Mr. President, we cannot put somebody in charge of our nation's health care who doesn't know how to separate fact from fiction. No one in the Senate should be comfortable with that. But the dangerous misinformation, it doesn't stop with vaccines. Mr. Kennedy claimed that antidepressants, not guns, are to blame for school shootings. Let's be clear, folks, there is zero evidence to support that. None. What we do know, and what the data tells us, is that every other developed country, they also have antidepressants. What they don't have is America's level of gun violence. The difference is not mental health treatment. It's easy access to guns for kids, for criminals, and dangerous people who shouldn't have them. Mr. President, my family and I have lived with the consequences of gun violence. My wife, Gabby Giffords, was nearly killed by a gunman when meeting with her constituents outside a grocery store in 2011. 6 people died, 12 were injured. You won't find anyone at that grocery store who believes that an excess of mental health treatment was responsible for that tragedy. Not one. Gabby and I have sat in living rooms of parents who have lost their children in mass shootings. And we have fought for real common sense gun safety laws that can save lives. Just like Senator Hassan, I will not stand here and let conspiracy theories distract from real solutions. And this is the core of the problem. Mr. Kennedy treats healthcare like it's a conspiracy theory. Mr. Kennedy is not the person who should be running the Department of Health and Human Services. It's very clear. Now, if Mr. Kennedy was simply a private citizen saying these things, that would be one thing. It would still be a problem, by the way. But this is someone who wants to be in charge of all of our health care. And if his dangerous views weren't enough, he doesn't even understand the weight of the job he is applying for. In his confirmation hearing, he didn't know the difference between Medicare and Medicaid. He didn't understand the different parts of Medicare and what they provide for seniors. He didn't know what a community health center was. He couldn't articulate a basic managing plan for HHS's $2 trillion budget. He wouldn't answer as to whether he'll negotiate for lower drug prices for seniors. And that means if you're a senior with him in charge, you might see higher drug prices. Mr. Kennedy does not have a medical degree, and he has no experience, zero experience in healthcare policy. So this isn't just about bad ideas. It's about dangerous ideas and the fact that he is completely unprepared to do this job. We learned that at his confirmation hearing. We also learned Mr. Kennedy won't make decisions based on science, data, and facts, or what is best for our public health. Instead, he will do whatever President Trump tells him to do. Over and over again, when asked about his policies, he didn't give answers based on what he believes is right. He said, quote, "President Trump has not told me what his policy is." On reproductive health, quote, "Trump has told me to look into it, but I don't know what his policy is." This is a nominee who traffics in conspiracies, who doesn't know much about the agency he's nominated to lead, and who has said he'll just do whatever he's told. Which, considering what we heard all along, that President Trump, he has a concept of a healthcare plan, not a real plan. But we still don't know what that is. I mean, now that to me feels like a big problem. Mr. President, we need an HHS secretary who will lead with facts, not fear, who will lower the price of prescription drugs, or fight to do that, and fight to reduce healthcare costs, and not to go along with efforts to take health insurance away from kids and people with disabilities, who will build trust in our healthcare system, not undermine it. Mr. Kennedy has built a career out of rejecting science, spreading misinformation, and profiting off of fear. He has compared vaccine scientists to Nazis. He has refused to say if 9/11 was a conspiracy theory. And when it comes to leading this nation's healthcare system, he has no plan, no knowledge, and no independence. And he says he will do whatever President Trump tells him to do. So, my colleagues, we all have to ask ourselves, are we really willing to put the health of American families in his hands? Are we? Mr. President, I know my answer, and I urge everyone in this chamber to think very hard about theirs. And Mr. President, I yield 30 minutes of post-cloture debate time to the Democratic leader.
The senator has that right.
Mr. President.
The senator from Illinois.
Mr. President, if you go back exactly 20 years ago today, I could tell you exactly where I was. I was a patient at Walter Reed Army Medical Center. I was staring at the beige-colored walls, and amidst the pain in every inch of my body, I was trying to muster the strength to sit up, or to take a step, or even just to breathe. I spent months and months and months in that hospital room, hooked up to machines, getting wheeled in and out of surgeries, learning how to live again in my new post-shoot-down world. But despite it all, looking back, I consider every one of those days in that hospital room lucky days. Because when the worst happened to me, when that RPG exploded in my lap in Iraq and I needed serious, sustained medical attention to survive the hour, the day, the year, I had health care I could rely on. The same cannot be said for countless Americans. Americans whose healthcare costs have already been too high and whose access to care is in even greater danger if this chamber is foolish enough to confirm Robert F. Kennedy Jr. as our next Secretary of HHS. Put simply, Mr. Kennedy cannot be trusted with the grave, grave responsibility that comes with this job. He cannot be trusted with our lives. He is focused on pushing his agenda regardless of the cost to middle-class Americans. And if this man is confirmed, more Americans will die preventable deaths because of his policies. Next month will mark the 5-year anniversary of when COVID shut down our nation. In this moment, it is dangerous, reckless, and heartless to everyone who lost a loved one in the pandemic to even consider nominating a guy who has stated that, quote, no vaccine is safe and effective. And if our Health and Human Services Secretary refuses to ensure children are protected against preventable yet deadly diseases like measles, RSV, whooping cough, or polio, it will be our kids, not Mr. Kennedy, who pay the price. I've gotten letter after letter from my constituents begging me to try to reason with my colleagues, to do whatever I can to prevent a man so ignorant of all things science and medicine from holding a position of such power over our children's next breath. One pediatrician in Illinois wrote to me, and I quote, "I will always remember the 9-month-old infant with whooping cough who could not be saved despite every high-tech ventilator and medication we had available." Another said, "I recall a father screaming and punching a hole in the wall when his 4-year-old son died of chicken pox." The stories, the letters, the avoidable tragedies go on and on. Imagine how much worse the heartbreak will become under a guy who acts like the term vaccine is a swear word. Look, the only reason that Kennedy is even up for confirmation is because he, like Elon Musk, decided to throw his dignity to the wind and bow down at Trump's altar. And because of that, he gets to be yet another rich guy with too few qualifications and too much power, somehow now charged with leading our government. Trump is running this country like the mob. Kiss his ring, pledge your unyielding loyalty, get made. It's just this time you get made into a cabinet secretary. Well, Kennedy has given Trump his fealty, so why would any of us ever think that he'd have the courage to stand up to Trump if the president issues an order that actively harms everyday Americans? How could any of us actually believe that Kennedy would fight back against Trump's worst instincts when Kennedy himself has proven time and again that he believes more in cacophony than science? Now, Americans are going to be the ones to suffer, because now, with Kennedy's confirmation, even programs as popular, effective, and vital as Medicaid will be in even greater danger. Republicans told us in Project 2025 that they would come for Medicaid, and this is the rare case when the GOP has actually kept its word, putting at risk roughly 80 million Americans who rely on Medicaid. Americans in red states and blue, in big cities and small towns, folks who may have never heard of RFK Jr., but who will certainly feel the effect when he rips away the health care their family so desperately needs. Medicaid is a lifeline for kids, for pregnant women, for people in nursing homes, for Americans with disabilities. But Republicans don't seem to care about any of that. It's obvious that Donald Trump has never stayed up late at night, hunched over the kitchen table with a calculator in one hand and a medical bill in the other, praying to figure out a way to afford his child's insulin. No, of course not. With every passing day, it becomes clearer and clearer that Republicans care more about tax breaks for the billionaires they pal around with on the golf course than prescriptions for the middle-class folks who actually work at Mar-a-Lago. And while that teacher in Peoria lays awake at night trying to work out how she can afford her father's home care now that he can no longer get those services through Medicaid, while that new mom in Chicago who's just learned she has stage 3 cancer is trying to find a second job so she can afford both diapers for her newborn and her own chemotherapy, Donald Trump and Elon Musk will be too busy lining their already full pockets to care. To my colleagues on the other side of the aisle, I am sure many of you have faced health crises of your own. I'm sure many of you have had a parent who's been sick, or a nephew who's been in a car crash, a spouse who's been in need of an emergency C-section, or a child who has relied on an autoimmune injector. Imagine if your loved ones hadn't cared, they could rely on, imagine if your loved ones hadn't had care they could rely on in the moment. Then ask yourself how you can sleep soundly tonight if you vote to further the agenda of a couple rich guys who so clearly don't care about making America healthy. They only care about tipping it even more in favor of the wealthy. They're not bringing back the good old days of Reagan. They're just bringing back the days of dying from the measles. And they're certainly not making America great again. They're making America sick again. That's the Trump-Kennedy promise. I care about my constituents' ability to afford their prescription medications, their ability to get the vaccines that will keep them alive through the next pandemic, their ability to survive those worst-case scenario health moments without going broke in the process. So for all those reasons and 1,000 more, I will be voting no on Robert F. Kennedy Jr.'s nomination. If my Republican colleagues care about any one of those things too, then they will have no choice but to do the same. Thank you. Mr. President, I have received a number of messages from my constituents describing what access to Medicaid means to them and their families. I would like to close by asking unanimous consent that they be printed in the congressional record. And I yield 30 minutes of post-cloture debate time to the Democratic leader.
The senator has that right.
Mr. President.
The senator from Nevada.
Thank you, Mr. President. Today, we're here to discuss President Trump's nominee to lead the Department of Health and Human Services, Robert F. Kennedy Jr. If confirmed, Mr. Kennedy would be in charge of a department with power to, well, regulate the food we eat, the medicines we take, and the vaccinations we depend upon. He would oversee agencies that provide health care to almost 170 million Americans, including hundreds of thousands of Nevadans who are on Medicare, Medicaid, and the Children's Health Insurance Program. I'm here today to oppose Robert F. Kennedy Jr. as our next Secretary of Health and Human Services. Confirming him would have disastrous consequences for our public health, for our seniors who rely on Medicare, for our families who get their health care through Medicaid. Well, let's start out with his lack of qualifications. Well, Mr. Kennedy, he's never worked in healthcare or federal government. He's probably best known for his skepticism of vaccines and spreading dangerous conspiracies and outright lies. Mr. Kennedy's history of promoting anti-vaccine misinformation, it's well documented and deeply troubling. Vaccines have saved millions of lives throughout history, and they remain one of the most effective tools we have to protect public health. Yet, Mr. Kennedy has spent years promoting debunked claims linking vaccines to autism, cancer, allergies, and autoimmune diseases. He spread lies about vaccine safety, making people fearful and increasing rates of unvaccinated people, which put all of us at risk. He's previously stated, and I'm going to quote,
"Let me ask you this, Ms. Gabbard, do you still support providing individuals who have access to top secret information with the ability to make their own decisions regarding whether that information should be publicly disclosed, even though disclosure may cause tremendous harm to our country or our allies?"
Senator, we cannot and should not have individual vigilantes within the intelligence community making their own decisions about how and where and when to expose.
Times, Mr. Kennedy refused to acknowledge that vaccines don't cause autism. He's also engaged in Holocaust distortion to push his dangerous views. While attending an autism conference, he was asked why the CDC wasn't acknowledging autism as an epidemic. And he said, I'm going to quote again, these are his words, "To me, this is like Nazi death camps, what happened to these kids. I can't tell you why somebody would do something like that. I can't tell you why ordinary Germans participated in the Holocaust." End quote. And frankly, Mr. President, these aren't the words of someone you want to be in charge of America's public health. These are not the words of someone you want anywhere near the White House, anywhere near our health care, our safety. He's even gone so far as to falsely suggest that certain antidepressants are behind the rise in school shootings, and that certain chemicals in the water might be part of why more young people are identifying as transgender, neither of which is backed by any science. And we can't allow someone who spreads this kind of vitriol and dangerous misinformation to lead the Department of Health and Human Services. But his problematic views are just the start. During his confirmation hearing, Mr. Kennedy was also asked about his understanding of Medicare and Medicaid. Just asked if he knew about it. Well, he struggled, I mind you, to remember which program covered older and disabled Americans. Struggled to remember which program provided for low-income people. This is Medicare and Medicaid. That's something that's so brand new that even Robert F. Kennedy Jr. shouldn't know what it is. Because Medicare and Medicaid are not mere government programs. They are a lifeline for millions of Americans, including our seniors, our parents, our grandparents, people with disabilities, families in need, including half of all children and around 40% of all babies born in this country. Why would we trust someone with the future of Medicare and Medicaid when he doesn't even understand the basics of the system he would oversee? This makes no sense. And we can't overlook the broader impact of Mr. Kennedy and President Trump's proposals on medical research, safety, and innovation. We're already seeing devastating attempts to go after the National Institutes of Health, or NIH, the very institution that has pioneered life-saving research in areas like cancer, heart disease, and diabetes. And this is not just any research, this is life-saving research. We're talking about research and clinical trials. Well, in my home state at the University of Nevada, Las Vegas, and the University of Nevada, Reno, to better understand Alzheimer's disease and improve care for patients. We're talking about advancing breast cancer therapy at the University of Nevada, Reno, and clinical trials on treating and preventing cancers at the Southern Nevada Cancer Research Center. You know, I lost my mother to cancer. I lost my brother to leukemia. I think it's shameful that this administration, enabled by RFK Jr., would target research into these deadly diseases, which cost lives in my family. I don't want anyone to go through what I went through. I want other people's families, their parents, their siblings, their friends, to be able to live. And we know lives are saved every day because of investments in research, in those clinical trials, and what the NIH does. I want people to live because of the research. It matters. You know, Mr. Kennedy has also proposed radical changes to the Food and Drug Administration, the agency in charge of, well, the food we all eat and keeping it safe. And just like many of the other reforms proposed by Mr. Kennedy, his suggested changes to the FDA, well, they're based largely on the many conspiracy theories he peddles. These broad changes include clearing out entire departments like the Food and Nutrition Center, which is responsible for preventing foodborne illnesses and ensuring that chemicals in food, the food we all eat, every single one of us, all around this country, every day, from young to old and everywhere in between, that our food is safe. How does dismantling this keep any of us safe? How does it keep any of us healthy? Mr. Kennedy has an overarching plan to gut the funding for FDA, which will severely limit regulation and safe implementation, also of new drug trials, medications. And this could lead to dangerous drugs flooding the market, putting countless lives at risk. You know, Mr. President, the role of the Health and Human Services Secretary, it is one of profound responsibility. And Robert F. Kennedy Jr. has undermined the very foundations of our public health system. Mr. Kennedy's vision for the future of our healthcare system, well, he wants to undermine Medicare and Medicaid. He wants to slash cancer research funding. He wants to push dangerous public health conspiracies. These are visions and these are things I cannot support. No one should support. We all want a healthier future for America, one that both prevents diseases and where we can think about curing diseases, where we can do preventative medicine, curative medicine, where we can have that hope for folks whose mother gets lung cancer in the future, that she might live, or leukemia in the future, that their brother might live. Mine didn't, but I hope that they didn't die in vain, because research goes on and will help others. And I want us to be able to cure diseases for the ones that we love. And so that is why I cannot in good conscience support Mr. Kennedy's nomination, and I urge my colleagues to do the same. The stakes couldn't be higher. Our very lives, the lives of our loved ones, they may just depend on it. Thank you. Yes. Post-cloture debate time to the senior senator of Oregon.
Mr. President.
The senator from Massachusetts.
Thank you, Mr. President. Mr. President, I stand here in strong opposition to the nomination of Robert F. Kennedy Jr. to serve as the Secretary of Health and Human Resources for the United States of America. The American people know that our healthcare system is broken. Families have to work through too much health insurance red tape, only to be denied care or forced to pay out of pocket. Medical debt is the leading cause of bankruptcy in the United States. Families are saddled with medical debt from prices that are too high and burdened by quality of care that is too low. When they need to get an appointment, they have to wait months, drive hours, or simply go without the care which they need. Pharmacies, hospitals, community health centers struggle to keep their doors open, and communities are watching health providers and workers burn out under the strain of a healthcare system that is increasingly being sold out to greedy investors and the billionaire class. The American people deserve a real healthcare system, not the current sick care system. And they deserve leadership, which will recognize all of these problems and commit to solving them. Instead, Donald Trump and Elon Musk are only making things worse. To Elon Musk, move fast and break things is not in the United States Constitution. That's why these federal district court judges are stopping your actions. In Trump's first 3 weeks in office, he has taken illegal and unconstitutional action that disrupted life-saving health research, sent Musk and his Doge acolytes to make cuts in Medicare and Medicaid, cut off federal funding for community health centers, used discriminatory fear-mongering to threaten federal funding for hospitals and health providers just trying to provide care for their patients. Every chaotic decision, every cut, every illegal action are all to make it easier for this administration to work alongside congressional Republicans to slash and burn our core healthcare programs. They're not doing this to make things better for everyday Americans. It's Robin Hood in reverse. They are working to take from those who need it the most just to give billions more in handouts for defense contractors and their billionaire donors. They want hundreds of billions of dollars in tax breaks for billionaires. They want to increase defense spending by $150 billion, more nuclear weapons, more. But then it turns and says, where are we going to get the money? And they say, oh, we're going to Medicaid. We're going to the Affordable Care Act. We're going to community health centers. We're going to go to the programs that actually do protect people. More nuclear weapons aren't going to protect people. It's having access to the health care system that can help protect their families. Now, Trump and Musk and Republicans, they're going to call it efficiency, or they'll call it transparency, or they'll say it's just adding basic requirements to Medicaid. This is all code, the code for cuts. Efficiency, transparency, or just be honest about it, Elon. Just be honest about it, President Trump. Cuts to programs. They keep saying there's all kinds of waste in the system. Well, point it out to us. We'll cut it out for you. Give us the list of the programs you want to have cut because they're waste, and we'll do it. But you want to know what they don't want to say? They don't want to say that they want to cut Medicaid. They don't want to say they want to cut clean air, clean water, the programs to protect ordinary people. They want to call it waste, and we're going to call it out for what it is, where they're going. They're going to the programs that help provide the health care for ordinary Americans. Cuts to health care that Americans rely upon. And when Americans have to wait longer for care, when they have to pay more, watch the only hospital in their community shut down, the blame for what will happen will lay at the feet of the politicians who put self-interest above the interests of the American people. And rather than consider a nominee who would seriously protect and preserve the health of the American people, Donald Trump nominated yet another enabler to his cabinet, Robert F. Kennedy Jr., who instead of standing up to the Trump-Musk chaos, will only add fuel to Donald Trump's Make America Sick Again campaign. Because that's what it is. Make America sick again. Ralph Waldo Emerson from Massachusetts, he said, health is the first wealth. Well, that first wealth is going to get looted, so billionaires get even richer. And serving as Secretary of the Department of Health and Human Services is an immense responsibility. The agency oversees the Centers for Disease Control and Prevention, the Food and Drug Administration, the National Institutes of Health, which is made up of 27 institutes and centers, and each decision that an HHS secretary makes will have a huge impact on our healthcare system. Run well, HHS ensures medications are safe and effective, keeps workers and students and seniors safe, protects the public from global pandemics, or disease outbreaks, guarantees hospitals, doctors, and community health centers provide safe, quality care, and funds research that will build the foundation to accurately diagnose patients, better treat cancer, cure Alzheimer's, heart disease, diabetes, cancer. That's what it's supposed to be all about. Not freezing that funding, not cutting that funding, but ensuring that the researchers have the funding they need. Because research is medicine's field of dreams from which we harvest the findings that gives hope to families that we will find the cures for those diseases that have run through their family's medical history. And we know that HHS says Health and Human Services, but it also stands for Human Health Security. And the stakes of leadership are life and death. But instead of nominating a serious and qualified candidate, Trump selected a candidate who questioned the well-proven conclusion that HIV causes AIDS, made millions by spreading lies about vaccines, compared vaccine mandates to Nazi Germany, said Wi-Fi and cell phones cause leaky brains, threatened to remove fluoride from drinking water, and made baseless claims about medication for depression that it would lead to mass shootings. Well, Mr. Kennedy's track record shows that he is a danger to the health of America. He would make America sick again. In June of 2019, he went to Samoa on a trip arranged by anti-vaccine activists. He used that trip to spread lies about the measles vaccine in the Samoan Prime Minister and Director General of Health. He and the organization he led amplified activists who spread false information about the measles vaccine. And after a measles outbreak broke out in Samoa and 16 people died, rather than intervene and help, Mr. Kennedy sent a letter to the Prime Minister to blame these deaths on the vaccine rather than the absence of vaccines. The death count in Samoa grew to 83. Volunteers in New Zealand sent tiny coffins to help bury the dozens of children who died. A New Zealand vaccinologist later said the impact of Mr. Kennedy's role in the outbreak was devastating. In a moment, when Robert F. Kennedy Jr. could have used his influence for good, he fueled disinformation that cost lives. When Robert F. Kennedy Jr. was asked about Medicare and Medicaid, he could not answer questions in his confirmation hearing about the most basic questions, demonstrating that he would be at HHS only to make whatever cuts that Trump and Musk and Doge dictate at the expense of the healthcare of the American people. Now he's in line to be the #1 healthcare official in the United States. That would be a disaster. Mr. Kennedy has reportedly given reassurances on his position on vaccines or on his position on food and chronic disease. To my colleagues, I would say this: we cannot address chronic disease if we are slashing Medicare and Medicaid and the Affordable Care Act, or recklessly cutting off funding from hospitals and community health centers. If we are battling vaccine misinformation, it will make it much more difficult to take on chronic disease like heart disease or diabetes. The long-term impact of food on children's health doesn't matter if children are dying from preventable infectious diseases because their families believe misinformation spread by the nominee for Secretary of Health and Human Services. And even with the promises he has made on the vaccine misinformation, Robert F. Kennedy Jr. has not demonstrated that he will fulfill his promises. He has used his position to lead people down the dangerous path of vaccine misinformation. And when asked about his role in the Samoa measles outbreak, he lied. The stakes are too high to take a risk on this nominee. I hear from people in Massachusetts who rely on our healthcare system, single mothers of disabled children relying on Medicaid, also called Mass Health in Massachusetts, to make sure their child gets care. I hear from people living with cystic fibrosis, or parents of children on the autism spectrum or with Down syndrome who could only afford their medication or coverage with Mass Health Medicaid coverage. For them, Medicaid is the lifeline. And when that lifeline is cut, their lives get harder. And that's what this administration is aiming to do with Robert F. Kennedy Jr. in the lead. The American people deserve more than what they have now. They should be able to get health care when they need it, and they should not have to worry that it's available. They should be able to go to their doctor or to their pharmacy without running up their debt or being forced to choose between paying their rent or a medical bill. They should have health providers that aren't too overworked and burned out to provide them quality care. They should have primary care, mental health care, addiction care, dental care, cancer treatment, and more available to them without waiting months or traveling for hours or being left to hope for an available clinical trial. Americans should have unquestioned health care access and quality, and I want to deliver on that for every single American. But Robert F. Kennedy Jr. will only make this harder by embracing Donald Trump, Elon Musk, and the spread of vaccine disinformation. I'm not alone in my concern. I've received over 1,000 calls and emails to my office opposing his nomination. I have also received letters from over 20,000 physicians, including thousands of pediatricians, internal medicine, emergency medicine, doctors representing all 50 states and Puerto Rico. Over 800 public health officials, 75 Nobel laureates oppose his confirmation, chairs of pediatric departments across the country, and statements from the Massachusetts Teachers Association representing over 11,000 educators, and from the National Nurses Union representing 225,000 nurses, all opposing Robert F. Kennedy Jr. Every single one of them expressed concern and dismay about having a Secretary of Health and Human Service that doesn't believe in vaccines that save lives. We need to listen to the people on the front lines, the health providers who have dedicated their lives to serving their patients, the researchers who have committed to finding life-saving treatments and cures, and the educators who care for our nation's children each and every day. They are all saying no to Robert F. Kennedy Jr. He is unqualified, and his confirmation would be dangerous to the health of our nation. And with that, Mr. President, I yield back.
Mr. President.
The senator from Connecticut.
Mr. President, I come to the floor with sadness and anger because we are here to consider the nomination of a person who very tragically and unfortunately is unworthy and unqualified and unprepared for this position. And Robert F. Kennedy Jr. will, in fact, betray the trust and credibility of the office he's been nominated to fill. He has already shown that he lacks the trust in science and the adherence to the truth that is so important, because this office is fundamentally about advocating for public health, informing the public, speaking truth to the American people when there is so much misinformation and disinformation about what will keep Americans healthy and make them healthier. And he threatens literally to make America sick. Whether it's make America sick again or just make America sicker, the fact is he has supported conspiracy theories and distorted views of what is important in public health that threaten the American people. The Nobel laureates, the healthcare professionals, the members of his own family, and in a certain way, I would say if you have any question about Mr. Kennedy's qualifications, you should listen to Caroline Kennedy and her very powerful comments on his nomination. The fact is that her comments are an indictment. They are literally a warning against his nomination, stating that he is, quote, addicted to attention and power, and that he has already, quote, denigrated our healthcare system by championing beliefs that cost lives. Ultimately, the confirmation process so far has confirmed what we already know, that as a source of information, advocacy, and truth, he is less than Americans deserve. Americans deserve someone who believes in the Affordable Care Act and its premium tax credits that reduce healthcare costs for millions of Americans who otherwise would be left uninsured and unable to afford healthcare. Americans deserve a secretary who will advance research into life-saving medicines, treatments, and vaccination. He's not that person. Americans deserve a secretary who will protect Medicaid, which provides health care to nearly 1 million Connecticut residents, including 350,000 people. At the very least, someone who knows the difference between Medicaid and Medicare. He is not that person. And Americans deserve a secretary who will protect the sensitive health data of millions of people across the country. When the Department of Government Efficiency, which is an unregulated and potentially unsanctioned organization, gained access to millions of seniors' records at Medicare, Mr. Kennedy purposefully said nothing. And at the very least, we need someone who will stand up to President Trump when he spreads misinformation from the White House, someone who will stand up to him when he asks that his Secretary of Health and Human Services do something illegal or immoral. And clearly, Mr. Kennedy is not